Hello everyone. I will be presenting my project SAFAI or Sustainable Approaches to Fecal Sludge Management for Accessible and Improved Sanitation for the Peri-Urban and Rural Areas of Ahmedabad Urban Development Authority. This study was done as part of my second semester Masters of Urban Infrastructure Planning Studio titled City Infrastructure Plan, guided by Dr. Shashwat Bandyopadhyay and Gagi Mishra at the Faculty of Planning, CEPT University, Ahmedabad. Ahmedabad is one of the fastest growing urban areas located in the heart of Gujarat. The Ahmedabad Urban Development Authority, or the ORDER region, consists of the Ahmedabad Municipal Corporation (AMC), five municipalities, and 169 villages deemed to be urban soon. Ahmedabad started laying its first drainage system as early as in 1890 by the then first president of city municipality Ranchhod Lal Chota Lal. Ever since, the city has extensively worked on spreading the sewerage network by aligning itself with various national and state level policies and missions. From reviewing secondary sources, it was found that households within AMC use a pour flush toilet connected to a central sewerage system with a 97% coverage, while for ORDA municipalities, it was found that the households are using pour flush toilet connected to either sewerage network with only 39% coverage or septic tank pits. As we moved to order villages, it was found that the households are using pour flush toilets connected to septic tanks or single pits in the absence of sewage systems. The findings pointed out a lower level of service delivery in the peripheral order villages and municipalities as compared to AMC. Dependency on on-site sanitation systems and absence of treatment infrastructure has led to indiscriminate dumping of fecal sludge in open areas and water bodies, leading to significant health and environmental risks. Having access to individual household toilets is not enough, but the waste generated from these systems should also be properly treated as per the government guidelines and safely disposed. And as these areas continue to grow, they need intermediate strategies for filling these infrastructure gaps. Is centralization then the answer to this challenge? Extending the central sewerage network to these villages is constrained by time and money. The current process for getting access to a centralized system demands the village to have a town planning scheme in place and more than 65% construction permission applications submitted to the order office. Only after this, the concerned authorities start laying the trunk infrastructure and the residents can apply for a connection. This rather infrastructure following the development approach puts these areas and the city eventually at risk as it expands and affects its livability. Therefore, intermediate strategies for FSSM are required to address these challenges in a sustainable and cost-effective manner till the peripheries can be covered under the centralized systems. India is making significant strides in fecal sludge management, with cities like Leh, Tiruchirappalli, Devanahalli, Dhenkanal district, among others, leading the way through innovative funding and investment strategies. Strategies such as urban-rural convergence through co-treatment and fecal sludge in existing sewage treatment plants or fecal sludge treatment plants in nearby urban areas emerge as popular solutions. Therefore, this study proposes sustainable approaches to fecal sludge management for accessible and improved sanitation in the peri-urban and rural areas of ODA region with an urban-rural convergence model through co-treatment of rural septage with wastewater at urban STPs for a cost-effective system. Urban-rural convergence is a method by which urban development authorities can leverage the existing urban infrastructure to aid the peripheral rural development with short and medium-term strategies such that it eases the transition of these rural areas when the city limits expand. A detailed step-by-step process is worked out here to implement the same. The remedial strategies rely on leveraging the existing urban STPs to co-treat the fecal sludge from the villages. Therefore, a capacity assessment of the existing and planned STPs based on AMC records is done to identify the spare capacity. The four STPs identified with maximum spare capacity available are marked on the map. The estimated future demand for order villages by the year 2031 is 118 MLD and 180 MLD by 2041. The spare capacity available with the urban STPs exceeds the future generation of these villages, which shows promising potential of utilizing the identified urban STPs. To leverage the identified urban STPs to co-treat the rural waste, a catchment mapping was done. The SPM guidelines in the Manual for Fecal Sludge Management states that the treatment facility should be located within 10 to 15 kilometer radius of the areas to be served. Adhering to these guidelines, through catchment mapping, 4 village clusters were identified that can be plugged in for co-treatment to the 4 STPs. As recommended by the Fecal Sludge Management Alliance in their manual of co-treatment of septage and fecal sludge in sewage, the fecal sludge from these identified clusters can be either discharged into the sewer network through decanting stations equipped with proper facilities for screening, grit removal, and if feasible, solid liquid separation, or can be directly delivered to the STPs through required facilities added. The Ahmedabad DPN order budget documents outline plans and investments to augment capacity and upgrade the treatment and trunk infrastructure for the municipalities by 2031. This creates a potential of utilizing this infrastructure to co-treat the waste from the villages that could not be covered in phase 1. A similar capacity assessment for these STPs was done, and the village clusters around these municipalities were identified to be plugged in. Following the same guidelines for discharge of fecal sludge into the treatment infrastructure, the surrounding villages can co-treat their waste. Through this model, 99 villages in phase 1 and another 51 villages in phase 2 will be able to have access to a safely managed sanitation system. This implies safe disposal of a total of 275 MLD waste which would have otherwise ended up dumped in the nearby water bodies or open grounds and farms. The success of this model in Ahmedabad can serve as a blueprint for other Indian cities facing similar challenges. By adopting the urban rural convergence model and co treatment practices, municipalities can achieve cost effective and sustainable FSM, ultimately leading to healthier, more resilient communities. Thank you.